Tonight, we continue to bring you stories from the 10/11 documentary Suffering in Silence, with a focus on resources that are available in Lincoln for those who need help with their mental health.
Whether they need therapy appointments, medication, or just someone to talk to, we're going to walk you through some of those options and what they say they're seeing on the front lines. Madison Cole, I spent some time with a handful of nonprofits who help out in Lincoln's mental health response. One of the takeaways was demand is rising, but not always in the way you may think.
What's going on?
For decades, Centerpoint has been there for people in need. From their crisis line, outpatient therapy, inpatient treatment, housing assistance, and more. But their jobs are getting more difficult as time goes on.
Today we're seeing more people with more severe symptoms.
Despite their vast number of resources and helping more than 4,500 people last year, they aren't able to help them all.
So right now, only probably 20% of the population that actually needs help with mental health or substance issues gets the help.
Dr. Dave Myers at Bryan Health's mental health emergency room says they're seeing the same increase in needs.
We see on average between 500 and 600 individuals a month that come through for mental health emergency assessment.
The mental health emergency room is the only one in the state, but they can only treat people for a few days. And while they have quite a few outpatient options for follow-up care, they don't have a lot of inpatient options.
Those beds on a state level are not available.
This can lead to longer stays in a facility not designed for longer-term inpatient treatment.
And it is very frustrating for them, and we're doing everything that we can to provide that safe environment for them.
They're calling for solutions.
So we are working with, with the state, the legislature, with all the different entities to help try to find solutions for mental health and behavioral health, for the behavioral health crisis that we're facing.
Centerpoint, too, says the more help, the better.
If you don't have enough residential treatment beds like we have, or outpatient or things like that, and people are out at the Lincoln Regional Center, they have a hard time getting out because there's no place to go. And if we don't have enough beds at the regional center, then because of the number of people that are really needing that level of care, then that clogs up other systems.
These two organizations highlighted two issues are reporting uncovered: mental health staffing and a lack of inpatient beds. Both topics we'll be covering this week. Tomorrow at 10, we'll have a story about bed counts at the Lincoln Regional Center.